Hello, this is Dr. Joe Garri from Mosa Plastic Surgery, and today I'd like to discuss with you the procedure known as bilateral buccal fat pad excision / reduction. Some of the features of a beautiful face include prominent cheekbones framed by a very subtle hollowing of the cheeks, creating something called an OG curve. This is an architectural term that denotes a construct of alternating S-shaped curves. This is best seen in the face when someone looks at the face at a 45-degree angle or in a 3/4 view, a pose very commonly used in social media as when taking a selfie, for example. Lack of prominent cheekbones or fullness of the cheek leads to a less than desirable relationship between these two components of the face. In these patients, the face appears full, round, and there is a loss of the optimal facial contour. Whether the issue is lack of prominence of the cheekbones and or fullness of the cheek or a combination of both of the above, there are treatment modalities that can be used to put these two components of the face into a more harmonious relationship, thereby increasing the aesthetics of the face. For lack of projection of the cheeks, for example, fillers, fat grafting, or implants can be used. However, today we're going to concentrate on the second component, that being the full bulging cheeks. For patients that present with the chief complaint of full round cheeks, the good news is there is a procedure called bilateral buccal fat pad excision that allows for the contouring of the cheeks by safely removing the fat deposits within the cheeks that makes them appear round or full. This procedure can be done as an adjunct to other surgical rejuvenative facial techniques such as a facelift, for example. But buccal fat pad excision can be done as a standalone procedure in an office setting, either with local anesthesia or mild sedation. In the body, most of the fat deposits are located just underneath the skin. However, there are certain anatomical locations both in the body and in the face where the fat deposits are located much deeper. These are not amenable to liposuction, and if they are to be addressed, they need to be excised surgically. In the face, such an example of these fat deposits are the buccal fat pads of Bichat. These are encapsulated, distinct fat deposits that are located deep within the cheek, not only deep to the skin, but also deep to the muscles of facial expression. These are the muscles that cause our face to move, as when smiling or speaking, for example. When these bilateral deep fat pockets are hypertrophic or fuller than ideal, they make the cheeks bulge, thereby making the cheekbones appear less prominent and making the face appear more full and round. Moreover, this fullness of the cheeks eliminates the subtle depression that appears below the cheekbone, thereby obliterating the desired OG curve. Buccal fat pad excision involves making a small 1 to 2 centimeter incision in the mucosa of the cheeks and through it accessing and removing these fatty deposits within the cheeks. The procedure itself takes about 1 hour for both sides and leads to minimal swelling and discomfort. Impeccable oral hygiene is important in order to reduce infection, and ice packs are recommended for the first 1 to 2 days. Final results take about 6 weeks to appear and are subtle but clearly evident. In summary, buccal fat pad excision is a well-tolerated procedure that not only recreates the optimal contour of the face, but it also leads to a thinner, more chiseled facial appearance. Thank you very much for your time and attention. Thank you.